Part A. Extract 1. Questions 1 to 12. You hear a gynecologist talking to a patient called Mihiraa.
Good morning, Mihiraa. Please have a seat. What brings you in today?
Morning, doctor. Well, it's been quite a journey, really. For the past 6 months, maybe, I've just not been feeling myself. It started subtly, Just a bit of pelvic discomfort, like a dull ache, usually around the time of my period. But then it began to extend beyond that, becoming more persistent.
I see. Can you describe the discomfort in more detail? Is it sharp, dull, throbbing?
It's mostly a dull ache, but sometimes it sharpens, especially after, intimacy. And the dysmenorrhea has become unbearable. I've always had heavy periods, but this is a whole new level. The menorrhagia is truly debilitating. I'm talking about soaking through Superplus tampons every hour for the first 2 days, and it just goes on for 6 or 7 days now. I'm practically housebound during that time.
That sounds very challenging. Mihiraa, are you experiencing any other symptoms alongside the pain and heavy bleeding?
Oh, absolutely. The fatigue is relentless. I feel perpetually drained, even after a full night's sleep. And the bloating. I look 5 months pregnant some days. My clothes don't fit, which is incredibly frustrating. I've also noticed a change in my bowel habits, more constipation, sometimes alternating with loose stools, especially during my period. And the pain radiates, sometimes to my lower back, other times down my legs. It's like a constant pressure. I've been trying to manage it with over-the-counter painkillers, primarily ibuprofen, but it barely touches the surface now. I even tried some herbal remedies, raspberry leaf tea, evening primrose oil. Nothing's really made a difference.
And your lifestyle, Mihiraa? Has there been any significant change or stress recently?
Not really, doctor. I work as an accountant, so it's a desk job, but I try to stay active. I walk my dog daily, and I used to go to yoga 3 times a week, but honestly, with the pain and fatigue, that's gone out the window. My diet is generally balanced, I think. Lots of vegetables, lean protein. I do enjoy a glass of wine in the evenings, but not excessively. I'm just so worried, Dr. Thompson. My mother had similar issues, though I don't recall her mentioning it being this severe.
Thank you for providing all that detail, Mihiraa. Based on your symptoms and family history, I suspect endometriosis. We'll need to confirm this, likely with a pelvic examination and possibly an ultrasound. To manage your symptoms in the interim, I'd like to prescribe Gynaecologist. This is a progestin that can help suppress the growth of endometrial tissue. It might take a few weeks to notice a significant improvement. For pain management, continue with paracetamol as needed, and we can discuss stronger analgesics if the Gynaecologist doesn't provide enough relief. We'll monitor your progress closely.
Will it have any side effects? I'm already so tired.
Some patients report headaches, breast tenderness, or mood changes initially, but these often subside. We'll start with a low dose and adjust as necessary. I'd like you to schedule a follow-up appointment in the 4th week, so we can assess your response to the medication and discuss further steps. Does that sound manageable?
Yes, doctor. Thank you. I just hope this finally brings some relief.
We'll do our best, Mihiraa. Just remember to keep your ear dry and protected, and continue with your ear drops as directed.
Extract 2. Questions 13 to 24. You hear a nurse talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. Thanks for coming in. Please have a seat. So, I see from your referral that you're experiencing some discomfort. Can you tell me what's been going on?
Oh, good morning, Henry. Yes, it's just awful. It started a few weeks ago, but it's gotten progressively worse. I've been getting this incredibly sharp pain. It's not a dull ache, it's like a searing, almost electric jolt, right at the base of the skull. It's not constant, but it's unpredictable, which is the most frustrating part. It just comes out of nowhere. It shoots up into the back of my head and sometimes even radiates down the neck.
I see. And on a scale of 1 to 10, how would you rate this pain when it's at its worst?
A solid 8, it's debilitating. It completely stops me in my tracks. I'm a bookkeeper, so I spend hours hunched over a desk, staring at a screen. It's making it nearly impossible to focus on the ledgers. The eye strain is another thing. I feel like my vision is getting blurry, and the fatigue is just immense. I'm so exhausted by the end of the day.
That sounds incredibly challenging, Mihiraa. Have you tried anything to alleviate the pain?
I've tried everything. My general practitioner suggested some over-the-counter NSAIDs, but they barely touched the pain. I tried paracetamol too, no luck. I even tried a heating pad and some topical analgesic creams, the ones with menthol. They give a momentary distraction but don't fix the underlying problem. My husband, bless his heart, even bought me a cervical pillow, but it didn't seem to make a difference. The pain is so localized, I just don't know what to do anymore.
Right. And just to confirm, you have no other significant medical history, no previous neck injuries, or musculoskeletal issues. Any family history of arthritis or similar conditions?
None that I'm aware of. My parents are both in good health, no major issues. I did have a minor car accident about 5 years ago, a fender bender, but I had no injuries then. My husband thinks it's probably a pinched nerve or something like that, but I just don't know. I'm hoping you can shed some light on this.
Okay, let's have a look. I'm going to perform a few examinations to assess your range of motion and palpate the area. I'll need you to turn your head from side to side, and also look up and down. This could be indicative of cervical spondylosis, but we'll need to confirm that. We'll likely need to start you on a course of muscle relaxants, and maybe a stronger anti-inflammatory. I'll also recommend some specific exercises and postural adjustments you can make at your desk. We'll start with a 2-week course, and then review your symptoms.
Thank you, Henry. That sounds like a plan. I just want some relief.
Okay, let's have a look. I'm going to perform a few examinations to assess your range of motion and palpate the area. I'll need you to turn your head from side to side, and also look up and down. This could be indicative of cervical spondylosis, but we'll need to confirm that. We'll likely need to start you on a course of muscle relaxants, and maybe a stronger anti-inflammatory. I'll also recommend some specific exercises and postural adjustments you can make at your desk. We'll start with a 2-week course, and then review your symptoms. Okay, let's have a look. I'm going to perform a few examinations to assess your range of motion and palpate the area. I'll need you to turn your head from side to side, and also look up and down. This could be indicative of cervical spondylosis, but we'll need to confirm that. We'll likely need to start you on a course of muscle relaxants, and maybe a stronger anti-inflammatory. I'll also recommend some specific exercises and postural adjustments you can make at your desk. We'll start with a 2-week course, and then review your symptoms.